Hey everyone, Dr. Harmon here. Today I'd like to talk about neck anatomy, specifically what distinguishes what we consider quote-unquote ideal youthful neck anatomy from age-related changes to the neck. I'd like to talk about surgery that can help address this, and then also discuss the fact that every individual is different and is born with different neck features, and when surgery is performed, the features that an individual is born with can affect the expectations they might have for final results. So one of the most important features of a youthful neck is the fact that the tissue, meaning skin and muscle, sits firmly against the deeper structures of the neck. And that results in a more prominent appearance of a couple other features I'm going to talk about. The first being what's called the cervicomental angle. And that's simply the angle between the jawline, which is more horizontal, and the neck, which is more vertical. And what's considered an ideal youthful angle is sharp, meaning there's a nice sharp delineation between that jawline and the neck. And age-related changes to the neck can result in a blunting of that angle, meaning there is less of a sharp transition, and that transition tends to occur lower down in the neck and farther forward in the neck. That's due to loosening of the muscle, and then secondarily, the skin of the neck. Now, the other feature that is present in a more youthful neck is something called the thyroid notch, which is just a little indentation of soft tissue right above the cartilage that sits below it, called the thyroid cartilage, that contributes to your windpipe and voice box. And that's, again, the result of tight tissue against those deeper structures. In men, it's more prominent because we have more prominent thyroid cartilage, but it can still be present in women. Neck lift surgery, and by extension extended deep plane facelift, is meant to improve the age-related changes to the neck. Now, that thyroid notch can be blunted or less visible, obviously, especially if the cervicomental angle that I talked about is more blunted as a result of hanging soft tissue. And so neck lift surgery, by working in the center, and the extended deep plane facelift by working on the sides of the neck, can help tighten the muscle and as a result the skin after surgery. That can bring that muscle back closer to those deeper, firmer structures, one of which we talked about, which is the thyroid cartilage, but the second of which is something called the hyoid bone. And that hyoid bone helps determine in youth where exactly the cervicomental angle sits, meaning the back edge, and how sharp it can be. So some individuals may be born with a hyoid bone that sits back and up, in which case that angle could be nice and sharp when you're younger. But other individuals are born with a hyoid bone that sits down and forward, in which case they probably did not have as sharp of an angle even in their youth. And as a result, tightening skin and tightening muscle against it can't result in what would be considered what we consider a perfect youthful ideal. And that's okay, because when we do surgery, we want to work in a way that tries to provide natural results, meaning results that try to restore some of the youthful features that the patient as an individual has, not what we consider the absolute ideal.